COVID cases continuing to surge here in Western New York, leaving local hospitals scrambling to deal with a high capacity.
News 4's Marley Tuskus has been hearing from hospital officials on how this is affecting their care. Marley?
Yeah, Don and Jackie, not only are they dealing with a spike of patients testing positive for COVID, local hospital leaders tell me that staff members are getting sick as well.
It's an all hands on deck situation.
According to the state's health department, just 7% of ICU beds were available in Erie County hospitals this weekend. As cases rise in the county, the hospitalization rate is rising as well.
What we're seeing is rising COVID cases, but the majority of them are either unvaxxed or those who have other issues, other comorbidities.
Kaleida Health had nearly 250 patients with COVID throughout their hospital system Monday. And more than 100 patients at Erie County Medical Center were positive Monday, with 10 people on ventilators.
About half of these admissions that we have currently that are COVID positive are actually here for COVID. Well, that means that those 60, 70, 80 beds are offline for other patients. And so what ends up happening is patients in the hospital end up backing up into the ED. There's no beds upstairs to put them into. But
hospital leaders say this is not their only concern. Staff members are also among those testing positive.
This morning, there were 171 employees out with COVID-19. A couple of days ago, we were up to 230. So it is definitely having an impact on operations.
This is leaving hospital systems short-staffed and having to juggle how they handle health care.
And we call it dual systems of care. And we think it's going to be here for a long time. That is how we're managing COVID-19 and then how we're managing everything else besides COVID-19, the regular day-to-day hospital. It's learning about all the things COVID-19, all the different variants. It's making sure we're protecting our employees, protecting our patients. So, but it's something that we look at it as we're going to be here in these dual systems for the long haul.
Kaleida Health is still open for all elective surgeries, but ECMC has been told by the state to stop all non-essential, non-urgent elective procedures for at least 2 weeks because they have so many COVID patients. In the studio, Marley Tuskus, News 4.